Today's webinar, the topic, of course, track, trace, instrument set management systems. This is webinar 2. This webinar is kindly brought to you by SAFMed. SAFMed has been a solutions partner in both in your CSSDs and your operating theatres for a number of years now. Well, over 30 years it is. I think we should be getting a nice cake with some nice candles, Justin. It's time to celebrate. Absolutely. Thanks, Justin. Okay, so as you may recall, those of you who managed to attend webinar 1 in this series, we focused on what is tracking and tracing, the terminology, so that we could clearly understand the difference between the two and how they work together. We looked at the various local and international guidelines regarding tracking and tracing, and we focused a lot on the Office of Healthcare Standards Compliance, so that is applicable in the South African setting. We looked at track and tracing and its role in record keeping, and we'll continue with that discussion today. We looked at the requirements of record keeping in the CSD, so the type of records we need to keep and why we need to keep them and the guidance around that. We also, unfortunately or sadly, had to look at the published papers on nurses and record keeping and the history that we have and how sadly poorly we often are with that. And I think we tend to be patient focused, and as a result, we sometimes forget to document everything that it is we are supposed to document. And we did a brief introduction into the two types or the different types of tracking and tracing systems. This being webinar 2, and the final webinar in the series, we'll take a more in-depth look at tracking and tracing systems. We'll look at manual systems, we'll look at digital or computerized systems, and we'll focus a little bit more on tray and instrument management systems as well, and slight differences between them and how they can all tie in together. Then to finish up with, we'll try to understand how these track and trace systems can be beneficial in our lives in CSSD, especially when it comes to record keeping and compliance, when it comes to staff training, when it comes to our CSSD efficiencies and productivity. So we know that the money people like to know how efficient we are and how productive we are. So an important aspect to take into consideration. And then our assets and our resources. And of course, our resources include our staff, a very important part of our resources. We did cover the fact that our records and our documents that we keep in the CSSD form part of our patient care documents, and that is very, very important. And I'd like to remind you that as professionals and professional nurse practitioners, we are responsible and we are accountable for our actions and our omissions. So if we've omitted to record something, we are responsible for that. And very important that we can be held liable for all of those actions, ones that we did and ones that we forgot to do equally. If you remember from last week, as I said, tracking and trace systems can be divided into two main categories or subcategories, that of a manual system and that of a digital or a computerized system. When it comes to the computerized systems, we can further isolate them or categorize them as those that focus on tracking and tracing, those that focus on instrument management. Sometimes they can do both, or perhaps they're standalone entities. Manual systems are used extensively in the South African setting already, which is really great to see. Of course, throughout the world, manual systems was the starting point for everybody. Then people got semi-manual systems. I'm going to use that word loosely. And then eventually people have now transitioned into digital systems. As a whole in the country, a lot of hospitals are starting to already adopt digital ways of patient records, digital ways of ordering stuff, digital ways of charging. So we're seeing a definite trend and a move towards making use of the IT that's available to us now. just to remind us on how manual systems work, and I've been doing some work actually for a group involving the rest of Africa and learning how, in fact, this manual system is great because some people really don't even have this. Some people only end up having just a piece of paper where we've tried to record stuff, and we often don't get everything recorded that we really need to record. A reminder to everybody, the manual system consists of a label gun. With the gun are some consumables, the labels itself, the envelope, and of course we always associate this with a process challenge device. The advantage of the gun is that there is a dial, as you know, that you can adjust, and with that dial you have the ability to make some changes, and with that you have the ability to using numbers and lettering, you can make unique batch codes. So you would be able to say that this batch of items about to go in the autoclave, by manipulating the dial, went into autoclave number 1, perhaps on a particular date, and perhaps you can use the initials of the individual who packed the items. So at the end of the day, all of that information together for everything in the same load has one unique batch code. A very important point when it comes to the ability to recall after a sterilization failure is to have all of the batches together. If we've just got a piece of paper where we record, we've put in a DNC set and a neuro set and an ENT set, yes, we know what was in the autoclave, but we don't know which exact set it was. So then it becomes very difficult to track, to recall those items. And so very important that you have a unique batch code. Of course, the process is that you create that unique batch code, you put the sticker on every set or every item that's now being loaded into the autoclave or the sterilizer, depending on what sterilization method you are using. You're going to put an extra label in the process challenge device. The process challenge device is going to be used, as you know, as indicated by the manufacturer. There's a chemical indicator inside the device, and that device helps us to understand or is representative of a pack, because of course at the end of the cycle you can't open all of your sets now to confirm whether they did or didn't have access, or whether the steam did or didn't penetrate into the center of the set. And then we would have a PC or process challenge device to aid us with that process. At the end of the cycle, we remove the chemical indicator from inside the process challenge device, as well as the label, so that that unique batch label is associated with that chemical indicator. That is our reassurance that steam has penetrated at least at one point in this load. That's part of our batch and our batch release policy. We affix that all to an envelope, so if anything happens, we've got information. The envelope, of course, can be used to store a variety of information on it. Depending on the design of your envelope, of course, you can record stuff like the hospital, the date would matter, the department, whether it's a washer or an autoclave, because this process can be used for autoclaves and or for washers. You can put your biotic test pack result in the envelope as well, which is the value out of having an envelope. Print out from the sterilizer. If you would like to keep your day's printout, you can place that in the envelope as well, depending on how you like to manage your information. Right, so the whole idea, of course, that we can track each set and instrument back to the actual autoclave itself. And at the end of the day, hopefully we have the ability to be able to track which patient these devices were used on. Or at the end of the day, in what autoclave did the instruments that were sterilized that were used on this patient, which autoclave were they in? Did they go through? Was the autoclave working? There is your evidence. Of course, the disadvantage of the system is you're only recording the data at one point of the C60 process, or the sterilization, or the instrument device reprocessing system. You're only recording one point of it, but at least it's one point, which of course is better than nothing. There's a really interesting article published quite some time ago in the Journal of Hospital Infection in 2005. So this is, of course, when the rest of the world was starting now with the manual systems. What happened is, you can see at this particular hospital, a member of staff in the operating room realized that there was an unchanged internal and external chemical indicator on this particular packaging of Sterireal. The batch label confirmed that the item had been packed and labeled for sterilization 6 weeks earlier. And somehow or another it appeared that the item had been dispensed, incompletely processed. Following the identification of the sterilization breach, they initiated a recall. And that recall involved 2 registered nurses visually checking through all the storage shelves and trolleys, including the operating room, as you can imagine, the CSSD store area, the various wards and the various departments in the hospital where items are dispensed or dispatched to. At the first recall, they found another 2 items which thankfully hadn't yet been used on the patient, where the chemical indicators hadn't changed colour, so the assumption was that there was some form of sterilisation failure, or the items never made it into the steriliser, could be either or. Because they were a little bit scared of this, they decided that they would repeat the process because it was so easy to actually recall all of the items. So the process was repeated. So the 2 RNs have spent a lot of time now going around trying to recall the information. So as you know, with the manual tracking and tracing system, the label, the batch label, is then placed, to give you an example, because this is the one over here, is then placed inside the patient's perioperative document. So the hospital staff then thought, well, this was 6 weeks ago. So they had to go through the theatre register and identify how many patients had had surgery in the last 6 weeks. So they had to review 973 patient records. As you can imagine, first they had to recall them and find them. I don't know where they were stored. Remember, I said the importance of storing all of these documents correctly. So they recalled all of those patient records and went through the perioperative form where the sticker had been placed. In the end, it seemed that 7 patients, they found stickers for 7 patients that had items from the same batch in the actual documentation. But however, the sterilizer records where we had written said only 6 items actually went into the sterilizer. So as you can see, there was really a discord now in what was written and what was actually done. Record keeping, hey, it really is an important aspect. So it made it quite difficult now to try and recall everything, and it made it a little bit difficult now to try and identify how many patients had actually had surgery with devices that were potentially not sterilized. One asks oneself, if you had a digital track and trace system, would that record keeping have been done better? Would it be easier to do the recall? Would it be easier to identify the patients? It certainly does depend on what system you have as well and how we used the system, whether we used it correctly. So talking a little bit more now about digital track and trace systems. So I need you to come on a journey with me. I need you to stand in your CSSD environment. I need you to visualize the CSSD. Okay. So think about this. You're in the CSSD, and we want to be able to record and document everything that we do in the instrument's journey, which means we're going to need something on the dirty side of the CSSD. If we've got an automated washer disinfector, especially if it's passed through, of course, hopefully we have, we're going to need some form of device on the clean side. We're going to need something in the pack room. We're going to need something near the steam sterilizer or whichever sterilization processes you're using. If it's a pass-through, you may need one on the other side of the steam sterilizer. And we're going to need something in the dispatch or the storage area if we want to record dispatching. So at the end of the day, we need some devices, and we would refer to them as workstations. And a workstation is a computer. And on that computer, what we are going to need is the computer itself. We'll need a keyboard, we'll need a mouse, and we would prefer to have a touch screen because it just makes the system a lot easier to use. We need a handheld scanner, preferably one that's not tethered. You know, if it's tethered to the computer, we're going to be a bit stuck. We need to be able to walk to the washer or walk to the autoclave with our scanner, so not tethered. And don't forget, it's going to have to reach, so it needs to be able to talk from the computer to the autoclave. So that distance matters. So the type of scanner we use would also matter. We need a printer. We need tray lists and tray tags, and at the very least, we're probably going to need around 4 workstations, depending on our setup. Remember I said that the ability to record everything accurately is influenced by where the equipment is placed. So I'm guessing from a minimum, you're going to need at least 4 workstations. Of course, we need the hardware, as now we refer to, but we need the software, so the programming that is loaded onto the computer itself. And then all of that information needs to be stored somewhere. And all our IT buffers will hopefully look after that for us. And that's a server, and either a physical server that's somewhere on site or within the hospital, or a cloud-based servery thing where everything else gets stored. So that we're going to get the assistance of our IT guys for that. And without a doubt, we'll need internet access. So when you're installing these systems, one, we've got to find a place in the CSSD, in the places in the area that we refer to, where it can go. Obviously, you're going to need some plugs and some electricity. You need an internet point, and it needs to be somewhere in an area that we can get to and that it's simple to use. Over and above that, we will need to be able to identify the individual trays. So in order to do that, using our computer system, we create tray tags. Those tray tags are placed on a plastic tray tag holder. The tray tag holder must be attached to the tray itself. So that each tray, because you might have 5 or 6 DNC sets, but you need to know each DNC set individually. So each tray has its own unique number to it, so that we can drill down back to the exact tray, not just any old DNC. Each person who uses the system is a user. Each user needs their own login code, and often we can just use a tray tag for that as well. The consumables are important now because the tray tags that we're attaching over here and the labels themselves are going to need to go through the washer. They're going to need to go through the steam sterilization process. So as you can imagine, I can't nip down to the local office stationery supply store and use any old label. I need to use a label that can go through a washing process and a label that can go through a sterilizer process. So the label printers, the type of ink, the label itself is bespoke because it needs to be able to go through this kind of process. If you want to get very, very clever, and sometimes it will be really worth it, we can choose to individually put dots or some form of marking on individual instruments, obviously ones that don't interfere with the passivation layer, not us engraving or anything silly like that. If you have, for example, a neurosys or a neuro needle holder, that's extremely expensive, that you want to be able to do the warranty claim on it. If you single code it, you'll be able to know exactly how many times it's been used, when it joined the system, and you can be more specific. And you can go down to individual instruments, but it is expensive and it does take time to be able to scan each individual instrument each time. So you may decide, though, that you've got a particular tray or a particular set that you're worried about, and you choose to put some individual markings on those. How does the process work? Okay, so remember now we've got the computer, we've got the software in the computer, we've got to tell it about the instrument trays. So you're going to need to share with your supplier every single instrument tray that you have and all of the instruments on that instrument tray. Depending on the tracking or depending on the software, it will depend on how everything is loaded. But ultimately, at the end of the day, the computer system now knows exactly how many trays you have and what instruments are in that tray. It's now learned this information, and using that, it has helped you to print the tray tag label for each individual set. Okay, so we've now loaded the information into the computer. We've got our workstation set up at each point where we know that we want to capture data. Now, how do we use the system? In your mind's eye, you're on the dirty side of the CSSD. The sets are coming in. As normal, we normally wait for a couple of sets so that we can prepare them to load the washer. So now we've got 8 sets have come in. We've opened up the instruments. We've dismantled them. We've prepared them in the tray nicely. Now we put our trays into the washer itself. As it is me, it's Anna working on the dirty side. I head off to the computer. I touch on the touchscreen in the program that now tells me I'm on the dirty side. I touch on the computer and scan my label my little unique identifier, so it gets me into the program, so it knows it's me now. At that point, and then on the program, I can select which washer it is. It's washer number 1. I'll work over to washer number 1 and I scan all of those tray tag labels. Ding, 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 ding. Close the washer, start the cycle. The computer knows, excellent, it's gone into the washer now. Great. I'm on the clean side of the CCSD. Depending on the layout and the circumstances, I might be able to use the same computer or workstation for packing as I use for the actual removal from the washer, but it depends on the distance. It depends on how busy my CCSD is, because I don't want a bottleneck, and it depends on how I'm going to choose to pack. I'll come to that in a second. But ultimately, again, I'm on the computer, on the clean side, on the other side of the washer. I'm going to go into the system, scan my bag, my badge, knows it's me. I'm going to remove my sets now from the washer. And while I'm removing them, I'm looking to see that everything's okay. If something has failed, a particular tray is not cleaned, there's some instruments on there that's not cleaned, I can now acknowledge that something's gone wrong with this load. In addition, of course, I've got my SDF or my process challenge device in the washer. I check to make sure that it has passed. And on the system, I can acknowledge now, great, everything went well, everything has passed, the load is correct. I can now take everything out, or if there's a failure at this point, I can acknowledge there's a failure. That set, I might have to now send it back to the clean side for it to come back in through the washer if it has failed. Excellent. Everything's good now. I need to go take my instrument tray and I need to go pack it. Take my instruments, I put them on the pack station. Over here, I'm ready. My computer is next to me. I log in because hopefully it's the next person now. The person logs in and begins the process of packing. You now have the option, you scan the tray, I log in, it's me, then I scan the tray and the tray data picks up, it's now DNC set number 4 that I'm going to pack, for example. I can have the option at this point to pack on screen, or I can have the option to print the checklist, which means I print the checklist, I can take it away to another workstation and do the actual compiling of the set, or I can choose to compile right here with my computer. Bearing in mind, if I'm choosing to compile on the computer, I may need more than one system, 3 or 4, I don't know. It depends on your circumstances, how busy you are, how quick the turnover is, but of course we don't want to delay compiling of sets if there are not enough workstations. There are value adds, of course, to everything. If I'm packing on screen, as you can see, let's use the marker over here. I can click over here and go, yes, the tissue forceps is there. Yes, the scalpel is there. Yes, the scalpel handle is there. Yes, the dissector is there. And the computer acknowledges 11111. It's correct. They are all there. If I get to something and now I'm struggling because I can't remember what the hell it looks like, if I click on the device, an image pops up here on the right that tells me what it looks like. That kind of stuff and that kind of data takes time to load. There might be things or pictures that you can get from the internet quickly, or you can even take pictures yourself. You can even take little recordings at the end of the day and load it into the system. And while you're packing, you can play the recording within the system to understand how I should put this back together again. Or the final image of the tray, once it's fully compiled, you can load that onto the system. Of course, this all depends on the make and the model and the type of system that you're buying. Not all systems do everything like that, but that's the essence of what we are hoping we can achieve. If you're packing on off screen, just on the printout, you're not going to have that value add necessarily because now I only have my checklist to work with. Right, you're still with me. As you know, we're in the CSSD. We've compiled all of our instruments. We've checked that they're all there. Now we print that checklist. We still need to sign the checklist. It's still me that did this. It's still me that needs to sign my checklist to say that everything's there. If something's missing and we still want to use the set, of course we can say that instrument is missing, but we are choosing now to continue to use the set with that particular missing instrument. There might be some extra notes in there that you can put in if you want to. You can also add that. Okay, so I need to put my trade checklist in. Now I'm going to wrap my set. Once my set is wrapped, obviously I can no longer scan the tag. So now I need a label, a batch label. So of course the computer will print for me a batch label as well. Checklist in the tray, wrap my set, and I stick my batch label on the outside. So that batch label is unique. It's unique to that particular set. I take my tray onto the sterilizer or the autoclave, in this case perhaps. I load the rack, put all of the items in. I scan myself, log on the system. It's sterilizer number 2 that we are using today. I acknowledge that this is going to sterilizer 2, and then I scan all the items. My little go ching, 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 ching. I still need a process challenge device in there. That is still something that is of importance. I'm still using that. That doesn't go away. End of the sterilization cycle, end of the thing. I can then again check my process challenge device and I scan all of those items out of autoclave again. If there's a decision in the dispatch area that you want to record where everything is going, and it also depends on your circumstances. Does it come straight out the sterilizer to a storeroom that's only in the CSSD, or have you got a storeroom that's in the theatre, or wherever it is, you can now decide. And then you dispatch the item, which means I can come, get my trolley, put all my trays on my trolley, log into the system. Maybe now I'm a theatre staff member, which means I have my own unique code, scan myself, dispatch this to Theatre 2. So now the system knows that that set's in Theatre 2. If you want to get really, 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 really clever now, perhaps you get additional software that's in the operating room. And in the operating room, again, I log into the system and I scan the exact patient that it's used on. That's an option as well, if you want to get that clever. So now remember, at any point in time when I go into the system, I know where my tray is. I can know that that particular tray actually, because I go to my area where all my inventory is and I click on that particular set, I'm looking for DNC set number 2, I can find that it's still in the washer. If I'm looking for DNC set 3, I can find that I've dispatched it to Theatre 2 already. So at any point of time, I know where everything is. That is tracking. I can track where it is throughout the system. Know where it is. If it's now disappeared, it's another story. Where is it? And you can always go back and look where it was lost. So maybe you'll be able to see that Dr. Puchenvold borrowed it or stole it. No, just borrowed it. I'm joking. So it's very important to be able to track so you know where everything is. If you don't use the internal software or the software in the operating room, you still have a barcode of some description. So here I'm using this example over here. That barcode is going to be something that you can peel off the label that was on the outside of the pack, and that can go into your patient's records. Again, at the end of the day, if somebody sues you, the patient sues you because they had a turned septic or some surgical site infection, at the end of the day, unfortunately, you're going to have to recall the patient's documentation. If you scan that particular barcode over there, you're going to get the whole history. Now comes the traceability of how that set was prepared. You can go all the way backwards to what autoclave it was done in, what day it was, who did it, what else was in the load if you needed to know that. Back towards who packed it, when it was packed, when it came back from the washer, which washer it went through, all the way back. So you're getting the entire history. So for the court case, you could say, I'm very sorry, sir, this particular tray has been washed here, went through that, the process passed, I've got evidence that my autoclave worked, my BIS passed, my bioedex passed for the day, my process challenge device for the day also worked. So I've done absolutely everything I can to do the right things. I've done all my quality assurance checks in my CSSD. And by using the system, remember what I'm doing is I'm scanning. The scanner is no harder to use than Pick and Pay. It's a question of scanning me, clicking on the touchscreen, scanning the item. It makes it so much easier for me to record all the information. It's a little easier. I have to change the dial, remember those little bits and pieces. It's a label that's printed for me. It's easy. I stick it on. It makes the system so much easier to use, ensuring consistency. Depending on the make, the model, the type of system that you buy, it's possible that you're going to get a system that can do quite a few things for you. One of the things includes you've got a whole robust list of all your inventory, so you know exactly how many DNC sets you have. You can load on the system individual items as well if you want to. You can store the items that you've got hidden in the cupboard on the system as well, so that it knows that you have them. So you've got an asset register at the end of the day. You have the ability to record things along the way. So if, for example, uh, there was a missing instrument, so you're in the dirty side of the CCT and now there's a tray or an instrument missing from your tray, you have the ability to record that at that point. So you end up with a whole list of non-conformances. You can define what those non-conformances are so that at any point you can read those kind of reports. Your system might be able to give you alerts or warnings. And remember, if you've now told the system that this particular tray is a very important tray and it can only go through a low temperature sterilization process. If you get to the autoclave, you've loaded it in the autoclave and you scan it, because you're now going to put it into the sterilizer, the steam sterilizer, it's possible that the system gives you an alert that says, warning, you can't scan this item into the steam sterilizer because it has to go through a low temperature sterilizer. Or if it was something that you try to put in an automated washer disinfector, you can get an alert that says, no, this has to go into a manual process. You can also scan a manual process. It doesn't mean that you can't record that the instrument went through a manual process. If it needed to go through a manual process, you must record that it went through a manual process. Or you might have an extra step where you want the instrument tray to go to the ultrasonic washer first before it goes into the automated washer disinfector. All of those steps can be included and added in the system. So you get all of these reports. Now remember, you're recording data all along the way, so you have the capacity to draw reports out of the system. Because data is logged at each step, it's logged by the equipment, it's logged by the operator, it's logged by position, time, and date. You can get so much information out of the system. So, for example, you can go back and by operator, you can go and look at a particular individual and think, okay, so-and-so always packs this really big set, or somebody really avoids always doing a particular set at all, or one person will take a hell of a lot longer to compile the same set as the next person does. Does that individual need some extra training? Do they need some help so that they can improve their practices? You'll be able to identify what sets are lying dormant. So if you've got 15 DNC sets and you only use 4 of them, what's happening with the rest of them? Do you really need them? Do you have a set of instruments that you bought 5 years ago for Dr. So-and-so? Dr. So-and-so's long left. Everybody's forgotten about that tray, but you need instruments for another new surgeon who's arriving. It gives you the ability to now maybe dismantle those instruments, that tray, and use those instruments elsewhere. So you've got a really, really good, robust understanding of all of your instruments and all of your stock, what you're using, what you're not using. You can see that you're using DNC set number 5 all the time and you never use DNC set number 1. Why? There's something about it. And at the end of the day, DNC set number 5 is going to need a lot more repairs. When you've got 5 of them, why are you only using the one and not the others? What's wrong with the others? Is there something you can do to improve them that you can get uniform use and improve your overall efficiencies in your system? So identifying training needs, but also knowing all of your resources. There's a published paper by Donna Swenson, and Donna Swenson was talking about benchmarking from one CSSD to the other and why it's so important and what the value adds is of collecting this data. Obviously, when you're trying to benchmark from one hospital to another, you need to take into account a number of variances and differences. If hospital A is only doing gynae cases and hospital B is doing orthopedic cases, it's going to take a lot longer to get all the sets in an orthopedic environment through the process. So they're going to take longer than the other hospital that's doing smaller gynae procedures. So in this example, Donna Swenson used an example of a particular hospital where they kept having an incident where they were missing instruments. And they were trying to understand why at one particular hospital they always have missing instruments, yet at the other hospital they don't have that many instruments. They also try to understand a few important factors like what was driving these issues. First, they realized that we need to divide the work we do into 2 different things, fixed work and variable work, and that becomes quite important when you're trying to determine the number of hours we need for doing fixed work and for doing variable types of work. So these kind of tracking systems can look deeper into this kind of information, which is really quite handy. I missed one slide. I did. Did I go through this? Oh, okay. In this thing, they realized that between hospital A and hospital B, the one hospital had a really, really high budget for replacements. So every time that there was an instrument missing, they quickly slipped in an instrument, whereas hospital B didn't have as much budget for missing instruments, which is why when they compared the various hospitals, the one was okay and the other one kept having missing instruments. So many things that you can look into with this data. This is about the productivity that we spoke about carefully as well, trying to understand how busy our CSSDs are and how productive they are. Donna reminds us that we want to be productive and we want to measure how productive we are and how quickly we can get an instrument tray through the system, but we must not skip a step, we must not cut corners, and we must, of course, follow manufacturer's instructions. The workload of a loan tray, of course, does raise the level of work that you need to do. So loaner trays makes it very, very difficult. But we can include loan trays in our tracking and tracing systems as well. For instrument and set management, there are a number of different things that you can do. You could have separate programs, additional programs that you might be buying, or you could use a standalone type system. This image on the right is an example of a standalone system. In this particular system, what you have is this device, this platform, this machine over here. You can have a monitor or a computer that is on the side. You need a handheld scanner. You still need tray tag labels. You still need individual people's labels. You still need those kind of consumables at the end of the day. This is an example. What is the process? Well, with this type of system, you're going to begin by loading your instruments onto the system. So you take the D&C set, you put the first instrument on the tray, the platform weighs it, it takes an image from above, both looking at the shape and the color of the instrument, and it now recognizes it, you attach a name to it, so now it knows that individual instrument. So you do that for each instrument, one by one by one. And at the end of it, you take the entire tray and you put it on the platform and it weighs the complete tray. It then does a calculation, and at the end of the day, it's going to be able to tell you within a very small percentage or a very small weight how accurate your tray is actually at the end of the day. It takes time. In the beginning, you have to teach it all of your trays and all of your instruments. Yes, all of these systems have pros and cons. That's one of the things. But once you've done all of that hard work, the value add later on is incredible. Okay, so now you've taught it your various systems. You've got a report of what instruments you have as a whole. You can draw on those reports. And now it comes to compiling your set. So with this kind of system, it can be used in addition to your tracking and tracing system, or it can be used as a standalone system. But remember, in that case, you're only recording through the process, you're only recording one point of the system. You can compile your sets quickly because you know the set, you know what it is, pop it on the thing and go, oh, great, everything's out, off we go. Or you get some form of warning and, oh, no, it's only 98%, or it's only 75% correct, or I'm missing something. Let me go back and look for what it is I'm missing. And that's how sensitive it is and how easily it can actually see what is missing. If you don't know your instruments, it's 3 o'clock in the morning, you're all alone, and you've got this really complex Dura set that you've never seen in your life, no problem. Put each item on, the system will now tell you, that's the whatever, and you can even put a little image in that it describes where in the tray that particular instrument needs to go. You do need to teach the system all of that information, but it is possible. And with that, you can get a variety of reports as well. This is a published paper in the Journal of the Association of Operating Room Nurses, where the unit in Singapore decided it was time to install some form of a system. They did this process over 3 phases and over 5 years because they were supplying instruments to a multitude of units. So they decided to focus on the orthopedic hospital section and then the next section to get the process in place. The reason that they decided to do that was because of the increased demand for the instruments that they kept growing, and they needed to maintain instruments of greater complexity. So they were worried about making sure that they maintained these instruments correctly. On some of the systems, you can even put in like a message. So when you scan it in the pack room, a message pops up, says, don't forget to look for the 2 screws on the retractor. Little things like that, you can use them to communicate with other parts of the hospital, of the CCT, if you need to as well. So this hospital decided, now they've got all these complex instruments, they're worried that people aren't doing them correctly. The best way to manage it would be to put in some form of electronic system. Their points that they raised at the end of that, in this abstract you can read over there, that they truly believe that the system improved the inventory as a whole. It improved the supply because they knew where everything was and where it was. It improved the overall quality management. It reduced instrument repairs. It led to savings through increased productivity, and it lowered expenses. I didn't include the clip where it said it actually gave them more time to let staff learn other things, which is a very important thing. They found that the reports were honestly invaluable, and that during product recalls, they could easily identify what sets they needed to recall in real-time location because you knew where they were, which makes it really so much easier to manage a recall versus sending the RM all over to try to find the sets in what ward, in what department. Are they in the emergency department? Are they in Caesar theatre, which is in the maternity unit? So overall, it does certainly seem that digital track and trace instrument management systems can have a multitude of values and add-ons and benefits. Remember, the World Health Organization guidelines remind us that we need to have records for each stage of the decontamination process, and that we should have a system in place that's either manual or computerized. All of these records, of course, must be maintained and kept for as whatever our national or legal requirements refer to. You heard some of the overseas requirements, which I thought were interesting, was that you need to keep these records for the duration of the lifespan of the instrument tray. It's quite a long time. The Office of Health Standards Compliance says we need a system for tracking and tracing items so that in the event of a sterilization cycle failure, we can recall our items, and that the tracking system indicators and marks must be placed on the packs, on the outside of our sets and packs. Right, so summarizing now the benefits of a track and trace system based on what I've explained. Record keeping, record keeping, record keeping, record keeping, compliance with record keeping. Accurate records, I pray, I hope. I do think they will help improve the accuracy of our record keeping because the system is easier to manage. Make for easier sterilization failure recalls and knowing what set was used on the patient depending on the system you're using. Staff training, because you can track inconsistencies, you can track inconformances, and you might be able to track it back to the actual individual and know who keeps making a mistake and what they need training on. Maybe it's a particular instrument tray that they need to improve. You will learn your instruments. I don't think we'll get lazy. Maybe we will, maybe we won't. It's a bit like using Google Maps, for example. For those of us that are terrible, Google Maps really helps us find direction. That I've learned from Google Maps. I don't think it will make you lazy. It's really great for new staff, for orientation and getting staff up and running quite quickly. Certainly from a productivity point of view, you can understand how long it takes you to compile your sets. It should help you compile your sets a lot quicker. It should help you locate missing items because you can know where they were the very last minute of the process. It'll help with that argument. No, it's in theatre. No, it's not. We sent it back. No, we sent it to you on Tuesday. We sent it back on Wednesday. No, we didn't. Will help solve some of those arguments, and you can benchmark if a hospital group were to install it, for example, they'd have the ability to benchmark from one hospital to the other. At the end of the day, you know exactly what assets you have. It's a better way of managing your sets. You can identify what's dormant, you can identify what's going for repairs frequently, and you can also work out why we only use sterilizer B all the time, and why do we only use autoclave C all of the time, why do we only use washer number 1, and why do we end up with all of this wear and tear on a particular piece of equipment when there are 4 lots of them. What can we do to improve our circumstances that we can manage all of our assets properly? So overall in the series, what have we learned? We've learned that in order to be compliant from a healthcare standards compliance point of view, that we need some form of track and trace system. We know that all of the guidelines, the World Health Organization, the USA, South Africa, Ireland, the UK, all call for the use of some form of track and trace system. We now know that there are different types of track and trace and instrument management systems. We know that manual systems have benefits, but the digital or computerized systems can help us to record and keep our records and help us with our compliance, our staff training, our productivity, and our asset management as well. Thank you very much for joining us today. Hope you enjoyed the session. As normal, we will email you the link to the test and a few survey questions. Hopefully, you learned something out of the system, and hopefully we can move on in the future and get to the point of endorsing and adopting the systems that now are available for us. Thank you so much. Have a great day.